country-specific regulatory requirements. Welcome! We have a very special guest today, Nadine, our expert chemist and compliance manager. She is here to teach you all about the country-specific regulatory requirements you need to know and understand as a manufacturer or distributor. So grab a pen and paper and get ready to take some notes and prepare to learn from the best. Nadine will share her extensive knowledge and expertise with you, helping you navigate the complex world of compliance and ensuring your products meet all the necessary regulations. This is a must-watch video for anyone who wants to succeed in today's global marketplace. So sit back, relax, and enjoy the lesson.
Hi there. You know by now that selling your product globally can be a nightmare. In this lesson, I want to give you an overview and an understanding of what it looks like to get your product certified in different countries. I'll be giving you a few examples of how the process goes and things to keep in mind about the process in different countries. Every country has authorities that are responsible for compliance. Some countries even have more than one. For example, America has the EPA and the FDA. The European Union has ECHA, Colombia has INVIMA, and I could go on and on. Now, for your product to be certified by these agencies, the whole production chain will be checked. Let's use MyAirShield as an example here. They produce air disinfectant devices. In Europe, it's necessary to ensure the following for a product like this: that all ingredients for the certification of analysis, especially the active ingredients, have a REACH number, that the manufacturer of the raw material is listed under Article 95, that the product is registered in the Poison Center notification, that the product needs to comply with the biocidal products regulation in every country, whether it be by a single notification, a registration, or even an authorization. Having a safety data sheet in the country's language, with the right label in the right language, and the rules like having the notification number and the Poison Center notification ID on the label. You would also need to supply the efficacy testing required for each country, depending on where you'd like to sell it, because each country has a different set of requirements for hospitals and homes. And these are just the requirements for ECHA in Europe, and just for one product type. I'm sure you get it. Compliance is no joke. After you've gone through the compliance process, some countries will just write you an email confirming that you import the product, and others will give you a number that proves that you can import and sell the product on the market. There are cases, like in Greece, where you would get a temporary number and you can import and sell your product. But you would still need to wait for about 6 months to get the full confirmation. Or cases like in Denmark, where you need to involve your clients, your distributors, just to get a number. So the distributor is part of the registration. Then you have countries like Croatia or Bosnia, where you need to supply the product and the documents physically at the agency. Or countries like Panama, that will demand that the documents you supply have been double legalized. So you get an apostille for the document and send it to the Panama embassy in the origin country to where the document needs to be apostilled. Or countries like Mexico, that will demand the original certificate of free sale, translated and notarized to allow a distributor to import the product to their market. You might also be in a nightmare that we've experienced in Mexico, where the head of the agency that needs to actually sign the registration is not elected for almost a year, and no product is getting any certifications. But you can also have some smaller issues. Like for countries that are bilingual, they may require bilingual labels to get permission to import the goods. In this case, designers would need to work hand in hand with your compliance officers and translators. I don't give you these examples to scare you, I promise. The point I'm making is this: if you go into the compliance process blindly, you will have an extremely difficult time getting your products out there. It's heartbreaking to me when manufacturers suffer terrible consequences for non-compliance with regulations like REACH, Poison Center Notification, BPR, Article 95 or ROHS. Most of the time, it's not because they're not capable of fulfilling those regulations, but because these regulations are always changing. So it's often the case that they just don't know them. On the bright side, there are some regulations which are the same for almost all the countries within the European Union. Like for example, the General Product Safety Directive, or GPSD, which regulates the CE directive, is valid for most countries within Europe. This also applies in the USA when we're talking about the Consumer Product Safety Directive, or CPSD, which is the same in some states of the USA, even some countries in North America. However, other countries like Switzerland, who are not part of the European Union, have a different set of requirements and have different certifications. The certificates you use for the product acknowledgement in the EU will be recognized but might not be acceptable to the authorities in Switzerland. Having said that, if your product has an FCC certification from the US or a GS certification from Germany, your product probably has high quality standards and is likely to meet the laws of the countries around you. Okay, that's it for our overview of country-specific requirements. Let's move on to our next lesson.